if what is the parity, if there has been like recent any sort of any pregnancy, if she is expecting any uh, or if she's using any OCPs like contraceptive pills or anything. And then I will ask like for past medical history, what is she like what does she have,
Mm-hmm.
um, if she's known diabetes or if there is anything, and what medication she is on, if she has currently started on any new medication by the GP or if she's taking over the counter, or and of course I would like to ask the family history for the same as well.
Mm-hmm.
And then I would ask the smoking, if she's a smoker, alcoholic, if she's taking alcohol in what amount, and if she's a social drinker or she's a chronic alcoholic. And also I would like to ask the driving as well, if it is impacting her driving.
Mm-hmm.
And but in this case, like it's very unlikely, but I would like to associate the symptoms as well. And I would like to ask about the impact, of course, the social history, the impact of her current condition on her job and her daily life activity. What is it like? And what her is like, if she has noticed any changes, if she, what is it related to any mood changes, any sleeping disturbances?
Good.
And after that, I would be asking for her for examination.
Right.
And also, I missed the past surgical history as well. Like, I did not ask for the recent hospitalization, the surgical history.
Yeah.
And then I would go for the examination. I would start for the general appearance, the general physical examination. What does she look like? What is her BMI? If she's obese, what is her appearance? And then I would ask the patient to spread her arms. I would notice for any tremors or anything. And then I would go for pulse. And if it is regular, irregular, how is it like? They are already given that it's 80 beats per minute. I
Yeah.
would look for the any radio really quickly, and then I will look for any rashes, any like uh, stains, or what we say, the darkening of the knuckles.
Yeah.
And then I would go for the blood pressure, comparing both of the arms. I would like to offer that. Blood pressure is high, and then I would like to palpate, go for the appearance on the face. You told that it was like hirsutism was there, the signs of hirsutism.
Yeah.
So yeah, so and I would like to palpate her thyroid also, a quick examination of thyroid, and then I would ask the patient to if she's able to stand from the sitting position without any support, like without hand support, to check for the proximal myopathy. And also, I would quickly examine the CVS and respiratory. If it is clear, then I would go for the abdominal stria. I would look for the signs of the abdominal stria. I would look for the signs of any acanthosis nigricans in the back of the neck and the axillary, like armpit.
Good.
And yes, and I would see for the any weakness of the joint. I would ask for that if she has any disturbed sensation or anything that she was, because she's diabetic. I would look for the pinprick sensation, sorry, pinprick signs also, and finger pricks also,
Mm-hmm.
or any insulin, or any libra patch, what we say for the diabetic glucose monitoring device on her arms. And yeah, so that completes my examination.
Right. Okay. And how you will investigate?
After asking the concerns, and then I will explain the condition, and then I will investigate this patient on the basic labs, investigate basic blood count, full blood count, and I would like to electrolytes, urine electrolytes, to look for potassium levels, sodium levels, for to look for signs of any hyperkalemia or hypokalemia,
Right.
and thyroid profile, and serum cortisol level, like morning cortisol level 9 a.m. And if required, if it is, then to distinguish it with the disease, I would like to investigate with the ACTH also, serum ACTH level,
Mm-hmm.
and of course fasting blood glucose levels, HbA1c. And since she is having also signs of PCOS, so
Mm.
I would like to investigate LH, FSH,
Yeah.
and uh, testosterone levels.
Yeah.
Yeah. And further, I would like to investigate her, since she has high blood pressure at the bedside. Also, I would like to offer the bedside urine dipstick,
Mm.
and uh, uh, VM levels, and also for further, if it rules the cause, to rule out the cause, I would then further investigate and for the CT scans if required, CT adrenal,
Good.
sorry, CTAP, if it is required, and what is the cause of it, if it is iatrogenic or if it is,
Mm,
depending on the cause, then we will require the scans.
Good. Okay, let me recap the case. Your approach is much better, Alhamdulillah. And uh, will like to just I will do the things systemically, so it will be great for the other audience also. And we can discuss this case again as needed. So, as you said, Dr. Atika and Dr. Amir, you performed. I think now Dr. Amir is in his initial stage of preparation, so it will be good for me to introduce my pattern of taking the history. So, I would say whenever we have the patient, we should start a good history taking. Now, this all clinical stations, we have enough time to take the history and do the examination. Before it was like history station was different and the clinical stations were different. Now it is combined together. So now we have like 15 minutes to do everything. So it should be done systemically. So whenever we are taking the history, so we should like I used to make the uh, when you are outside, you have the plain paper with you, so you can make the highlights over there. So what you have to do is, okay, just a minute. Okay, welcome, Dr. Vikash. Welcome, Dr. Vikash. We just finished the case, and now we are going to welcome.
Hello, sir.
Welcome, Jalaldi. Right. So we just finished the history and examination of one patient. So now I'm going to uh, recap this case, and then we will proceed from here. Okay, the patient was, just to recap for the newcomers, patient was Mrs. Jennifer, 35 years old lady, and she's known case of hypertension and diabetes. She presented in the clinical station scenario with complaining of weight gain, and she was having feeling of tiredness also. So Dr. Amir has performed, and our Dr. Atika also added the findings over there. So now I'm just recapping this scenario and then we will proceed from there. So as I told, we have to take the history in detail, like in 8 to 10 minutes. We have now 15 minutes. So 8 minutes, I think if we can keep like 8 minutes, we have to take the good history and then we proceed from there for examination. It will be great. So in the history, I used to divide the history uh, scenario in like PDFS, PDFS, P for presentation or present history, and P for past medical history. So, and the D for drug history, F for family history, S for social history. So you can write this from outside. So not to forget when you go inside. So you should not forget the sequence of the history taking, right? So P for presentation, the presenting complaint. Here we should apply OD para. Onset, duration, progression, aggravation, aggravating factor, relieving factors, and associated symptoms. So for the new colleagues who are just starting the preparation for PACES, if you follow this sequence, you will not miss in your history, and you will get the idea how to proceed in history taking. Again, the OD para, O for onset. So you can ask how it started, this problem is started, then the duration for how long you have got this problem, and then how it is progressing since it is started. Is it increasing, decreasing, or same? Okay, Dr. Jalaldin, we are not showing any screen right now. So just focus our discussion. Right. So duration and then the progression, how it is progressing. It is progressing fast, it is progressing slowly or gradually, or if it is improving or not improving. Anything making the symptoms or the situation worse, aggravating factor is there or no? Anything making it better, relieving factor, did you try any medicine for this or no? Then the associated symptom. For every presenting complaint, you have to see which area is involved. For example, if the presenting complaint is related to the neurology, so you have to ask the associated symptoms related to the CNS system. Uh, if you have got the presenting complaint like chest pain, so it is related to the either cardiovascular system or the chest. So you have to ask the associated symptoms in that system. If it is abdominal case, then you have to ask associated symptoms from the abdomen. So this is just like a brief introduction about the OD-para. So in this case, the patient presented with weight gain for last 1 year. She gained 10 kg weight in the last 1 year, and we have to ask the patient whether it is intentional or unintentional weight gain. So other way is, how is your dietary habit? Are you taking balanced diet, or you're taking some uh, high protein, high energy diets, like if you're taking high carbs, so it will increase the body weight. Then we have to ask the patient, what is your lifestyle? Do you do daily walk, or do you do any exercises or no? So in this case, the patient was having 10 kg weight gain, and it was unintentional. Although she was doing the daily exercise and daily walk, despite of this, she was failed to decrease her body weight. Okay, and diet is balanced also. So then we have to ask the distribution of the weight gain. Where is the weight gain more? So she told it is over the upper back area, and then it is the tummy area. So this also identifies what is going on with the patient. So then this is all about the weight gain. So then we have to think about what could be the possible differential diagnosis. What could be the possible differential diagnosis in a patient with weight gain? So this we can write also from outside, as there are different causes of weight gain that is commonly coming in the PACES examination. So it could be Cushing syndrome, pseudo Cushing's, it could be acromegaly, it could be acromegaly alone, or it could be part of MAN1. It could be hypothyroidism, it could be metabolic syndrome, and if it is female, like this patient is female patient, so it could be polycystic ovarian syndrome, it could be simple obesity, and it could be like diabetes, type 2 diabetes, and the other associated things can be there, like if the patient is presenting with obstructive sleep apnea. So if you have this differential diagnosis in your mind, then you have to rule out one by one in your history. So if I ask the patient about hypothyroidism, there are some specific questions that I have to ask to the patient, and the examiners is also searching these questions, whether I ask this question or no. So this comes under the heading of clinical judgment. So you have to ask the patient, do you notice any changes in your weather preference? So if it is hypothyroidism, patient will say yes. Okay. So if it is hypothyroidism, yes, the patient will say like, I'm like not tolerating the cold weather. Okay. And then the patient, you can ask about the constipation. You can ask about the skin dryness. So other features will also be there. So that will suggest that the patient could be a case of hypothyroidism. Similarly, we have to ask the question related to acromegaly. So acromegaly, we have to ask the patient, did you notice any changes in your facial appearance? Did you notice any changes in the size of the ring? Did you notice any changes in your size of the shoes? So these are the questions. If the patient say no, 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 so you can rule out acromegaly on your history. Okay. And then the headache also related to acromegaly, and it is also related to